Okay, it's 6:30. We're going to go ahead and get this started just so we're not here all night. Call this meeting of Health and Human Services to order. And could we have roll call?
Dale Schrader,
Julia.
Marshall Savitsky,
Here.
Jesse Becker,
Here.
Michael Maestri,
Here.
Chris Rust, Lorraine Gouget, John Pettit,
Here.
Carol Pearson, Sabrina Dunlap. Here. You have a quorum.
Okay, we have 5. So yes, that is a quorum. Please rise for the pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Are we in compliance with certification of open meetings law?
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, number 5 is meeting agenda. Is there any additions or changes from anybody? No. Okay, number 6, public comments. At this time, members of the public will be given the opportunity to address the board. Comments will be limited to 3 minutes or less. Comments directed at the board as a whole, not directed to an individual board member. Board members cannot respond to comments during this time.
I don't see any hands online.
Is there anybody in the room wishing to speak?
I think Chris Rust just joined us on virtual.
Oh, great. Welcome, Chris. Okay, no public comments in the room or online. So we will move to item number 7. There was no meeting last month, so this is considering approval of minutes from October 11th meeting.
I make a motion to approve those minutes.
We have a motion by Mr. Savitsky. And I will second that. We have a motion by Mr. Savitsky approving the minutes from October, and it's been seconded. Is there any further discussion? Hearing none. All those in favor signify by saying aye. Aye.
Aye.
Any opposed? All right, that passes. Number 8, committee reports. We have a LCO liaison report. Mr. Schuman, are you gave that in October?
No, I'm sorry, she didn't give it to me, so we don't have one.
Who normally does that if you don't? Do we have
Lorraine.
Lorraine, but she's normally not
She's
here.
out on travel tonight, yeah.
Okay, and then 8B is the Senior Resource Center. Is that Miss Johnson that normally?
All right.
Yes.
And wasn't there one attached though or not?
Up in the back is no.
No. Okay, does anybody have any comments on LCO liaison or Senior Resource Center? If not, we'll move to item 9, which is administration. Is that you, Paul?
Yeah, that's just that the list of the services that you guys can refer to, but I also make a comment on administration is that every month we'll try to have some program within the unit. Now we introduced all the units, some program, give you an overview. Last month we were going to do the Children Long-Term Care Services, CLTS. We didn't have a meeting, but I just told the staff, I said, we won't do anything this month and we'll resume in January. So that's it for that.
Okay. Anybody have any questions for Paul? If not, move on to number 10, adult long-term care.
Okay, you have Sarah Sebecki's report for your review. I'll make a few comments. The staff they are fully moved over to the new building. There's still some odds and ends that got to get taken care of, like some of the brochure racks mounted and a lot of other odds and ends, pictures and stuff like that. There's mixed reaction about being over there from the staff. The change is difficult for a lot of them to go over there, but they're hopefully going to adjust. It's a real nice space, and maintenance did a wonderful job. And I think once the place gets completely done and set up, and with Andy about this, that maybe at some point, and they used to do this when they had the group home over there, maybe we could have one of our board meetings there, and you guys could see the building down the road when it's done.
Is that, I don't know if that's allowed.
They've done,
Can we do an offsite committee meeting?
Yes,
board meeting?
yes.
they've done that.
Yep. Okay. That's a great idea. Then we should do that offsite meetings for other committees as well.
Yeah, county board's done it, Jesse.
Okay, can we move on to number 11 then, Paul? Is that all? you
Yep.
have?
Mr. Chairman, I got one question.
Yes.
for Mr. Groveck, the elder and disability benefits specialist, they've been, out in the community, where do they go for all this to help people out? Like the elder centers or? See, there was CBS, DBS.
If you want a list, I can get that for you next time,
Oh,
where they go.
okay. Cause I think that's real important, that's where they see the people and sign on.
They get them signed up.
Okay, number 11, behavioral health. Saw there's a report from.
Okay, Alicia Carlson's report. I'll just highlight a couple things here. With the CCS program, there's a bit of controversy. Cheryl Kettlehut, who kind of heads it up for Taylor County, is going to be retiring. And they hired a person that really doesn't meet the qualifications right now. And so the service directors in each county are going to be expressing their concern at an executive board meeting in the near future. I'm not sure how it's going to get resolved, but my understanding was that they have a new director and Health Human Services director that doesn't know CCS. And on the interview, they didn't have anybody on the interview that knew CCS, yet they hired this person to oversee it. So it's an issue. So just give you a heads up on that.
Is at the state level? Or we get CC's? I get my notes right.
It's our region.
Region?
Sorry.
Thank you.
Consortium.
Yeah.
Okay,
So there's certain requirements, I mean, listed in statutes or something that this person does.
Right, and earlier this afternoon, Alicia was filling me in, so when we had that meeting, give me a background, but some background information on it. And for some reason, I guess on the executive committee, Alicia's usually involved in those meetings and another service director, but they're just having the county directors involved this time. But as luck would have it, the Iron County director is also their services director, and she's loaded with information. She is going to let it fly during that meeting about the concerns. So, and I guess there's two things you can submit. There's a variance and a waiver, and you have to choose between one or. I'm trying to remember what Alicia said the difference is. You have to commit to one of those that you want to try to get, and they submitted two for both of those, and you can't do that either. So it sounds like there's some mismanagement going on. So, we will address it, and I will keep you posted on that. And the CLTS program, who was here last month to present, we'll reschedule them sometime in 2023. They're going through their case review, which is taking place this week, and they submitted all the materials. They don't do a site visit; you send them information in for them to review.
Okay.
And also with the behavioral health report, you have your mental health cost by client.
Yep.
Placements.
Is there anything that jumps out at those numbers that we should be aware of? Or be made aware of?
No, other than that, maybe Joe, you want to, if you're okay with Joe, chimes in here. There's an individual, 2 or 3 that's on the horizon that could really add substantially to the cost of the out-of-county placements. Is that a fair statement, Joe?
I think that's accurate. We have a couple of clients that have had some chronically mentally ill clients that have had some recurring problems, and we haven't been able to treat them within the community real successfully. They're currently placed out of the community, and at least for maybe 2 of them, I don't think they'll be coming back. Be at some high cost placements. One particularly is in Winnebago right now. So it's unavoidable. We continue to try to stabilize them and return them back.
Mr.
These
Chairman,
folks have insurance.
They have Badger Care or Health. As we know, it doesn't pay for Winnebago. And it doesn't pay for the cost of a group home placement. Basically, it's the county loan.
yeah, thanks, Joe. Is there any other questions? If not, I think we can move on to number 12, Child Protective Services.
Okay, you have your monthly report from Carla. Caseloads and stuff. I should let you know that we are down 2 CPS social workers at this point. And so the staff will be stressed for the near future, trying to cover that caseload again.
Down 2 from how many? Like, what number should it be?
5,
So it should be 5 and it's currently 3.
right?
Are they just on leave or are they gone?
Gone.
Their jobs posted.
Yeah.
Oh, yeah.
These wages and everything else, I guess. Yeah, one's been vacant for over a month now, and it's been posted. And then the other position is starting next week will be gone.
16th.
Yep.
I know.
So when you say posted, is it just on the website or is it also mentioned in any newspapers or anything?
It's been in the newspaper, it's
Okay.
on our website, and then we also have a couple other places those get listed.
Okay.
And I think they put it on the WICSA, Wisconsin County Human Services Association website.
And the so was that 12B now, substitute care report?
That's the youth out of county placement.
Okay. So any questions on that? If not, we can probably move on to number 13, youth justice.
And then you have your usual youth justice report. And I should say, when I say we have 5 staff, it's a combination between CPS and YJ. Because we have we have one worker that does some YJ and some CPS, but a total of 5 direct service workers, plus a social services aide.
I was just looking at this and it, you list the, number of delinquency referrals and school offenses and all that stuff. Just curious why you list race on there. Is that just because you've always done that, or is it something that is important in the statistics? Or if we list race, why don't we list gender or, income or sexual orientation? I don't understand why that matters, unless I'm missing something.
I can check with Carla, and if you guys would like it eliminated.
I mean, I'm not saying I want to eliminate it. I was just asking why we have to point out what their race is. I don't know what their ages are or their genders. To me, that's probably a bigger, more important for me personally, but I'm not trying to change anything if that's the way you've always done it. And there's probably a reason for it. I just was curious what that reason was.
There hasn't necessarily been always done it, because this particular report wasn't always shared with the board. But there's going to be a change next month, because Carla's been submitting it, but we're going to have our YJ worker compile a report, and she and I are scheduled before the next meeting to talk about what's going to be relevant on this report, and I can bring that up.
Maybe it was, and I'm guessing maybe it was just to differentiate from tribal members to non-tribal members, maybe. And if that's the case, maybe it could be written differently, like tribal members, non-tribal members. I don't know if I don't know. I'm not. It just kind of stuck out as unusual.
Yeah, I can't say for sure for this report, but I've asked that question because it's not specific to this, but like on our jail report, there's a breakdown.
Mhm.
And in the child CPS report, There's a breakdown as well of LCO versus not, but that's because the ICW places it on the CPS and then the county is responsible for the payment.
And we've gotten asked the question, how many of these placements are?
Right, that's what I've been told is that
Are
that
native
information's
versus
been
non-native?
requested.
I have no problem changing the language to native and non-native. Tribal and
Is the
non-tribal.
funding source different or? You know, Andy,
Or not,
their race,
no,
native, non-native?
no, when I've asked why it shows up in some of these reports, I was told that breakdown's been requested before. That's why it's been kept down there.
And we have it split out, especially because we've been asked this over and over and over again through the years. So I said, for mental health placements and for the child placements, I want a monthly report because the board in the past says they're not aware of what's going on and they get asked. So I go every month, we are going to have this on there and we're going to split it out so that people can't say that it wasn't in the, wasn't shared in this room on a monthly basis. And I think it is important to have a breakout between the cost of the LCO placements versus the non-LCO placements and non-tribal placements. So you can see what's going on. And people talk about the high cost of placements. Remember, by and large, we have no say with how the tribe places children. We have to pay for it. So people are going, why are we paying so much money? Well, we have no control over what the tribe decides to do. We have to send them. So to me, from that perspective, it's completely relevant. But we could change the language on here if somebody. I mean, I don't have a problem doing that. But I think it's why the placement so much. Why the placement so much?
Yes.
Paul, does this have anything to do with the 161 agreement?
Oh yeah, it's
Or
about,
does kids are placed?
it's about placements. Yeah.
Oh,
Not the youth justice report. The
no, but
No.
substitute care report.
Right.
the
Right.
residential
Right.
care,
Yeah, that one is.
Right.
have they passed the 161 agreement, Andy?
It's not been passed. When I talked to Paul, there's a couple
They're
additional.
still making some edits on it. But keep in mind, it's still in place. And I don't think any placements have been compromised. Whoever needs to be sent, whether sent, is being sent, is being paid for. So there's no drop in the function of it. No compromise.
All right. Is that all on youth justice?
Yep.
Okay, number 14, economic support. So the report by Shauna.
Yep, you have your monthly report for them and the performance. I want to note that this is the last one for our Northern Income Maintenance Consortium Administrator, Doreen Lang. She is going to be retiring. She is phenomenal. She's well known throughout the state for advocating for economic support and all the related services. It's a big loss for us. But on the positive side, I can't think of his last name. We have a gentleman that's been working in the consortium for years out of Wood County, working with Doreen. That's going to be the next administrator, and by and large should be a seamless transition. So we got pretty lucky in that regard.
So all these numbers, you said monthly. So food share benefits issued $500,000. That's for a month. Is that the?
That's my understanding. When she submits this is what's going on in the last month between reports.
And then in the middle of the page, it says food share 6-month report forms process, 472 process. And then at the top, food share cases, 1,179.
I believe every 6 months that that you have to have them processed to make sure you're still qualified.
So a report is different than a case. Food share cases, 1,179. Food share reports, 472 over 6 months. I just want to make sure this was for 1 month, because it looks more like it might be an annual, roll up. The numbers seem kind of high.
Well, like the 555, if you want, I could double check with with Sean and see if that's an ongoing total.
Yeah, because that'd be like,
Connection.
that'd be 7 million a year. And I don't know if that's right. It sounds high.
Unless that's from the beginning of the year to the end of.
Well, that's what
October.
That's what it
I'm-
looks like. So, but then Paul said it was a monthly report based on October. So, I don't know. I mean,
Well, I know she gets this data from the consortium. This is the monthly report that gets pumped out.
yeah,
I never knew how interested people actually were in the numbers, and she was in here a while ago and presented this, and I can get some more clarification.
yeah,
about
I'm
this.
interested in $7 million, you know, food share benefits. If that's a monthly number, then that would be 7 million for 12 months, approximately.
I
Okay.
will, I'll get that clarified. But the thing I always look in here is that their percentages about the performance are high, and we perform about as high as anybody in the state, if not the highest.
I mean, those are really high percentages. That's a A to A+ scores all across the board.
We have, and we have the largest consortium in the state, 12 counties.
That 500,000, that might be a monthly figure. You
For
figure that
12
many-
counties.
Well, just for certain counties, you figure that's 1,500, I mean, I'm just guessing, $300-400 a month. Food share benefit, that's 1,200 to 1,500 cases. Which is about what's listed there. So if each of those cases gets $300 a month, that's in the ballpark.
Right. So we don't know if those cases are for the month or for the roll up from January till
Okay.
October either. That's all I was trying. I
Yep.
didn't know,
Double check that.
maybe if it was just written different, like as of this date, or if the dates were, you know, if they put from October 1st, October 31st or whatever, or if it's from January 1st till the end of October. Because it doesn't really say the time frame that covers. So it's just, it could be misinterpreted.
I do think that's what was served that month, but I'll get clarification.
Yeah. All right. That's all there. We can move on to number 15, public health. Ms. Lyons. First of all, I want to apologize for raising my voice. I wasn't, we were just trying to do roll call, and I don't think you were aware that I wasn't yelling at you.
You got my attention. Okay, so the public health report was in here, but I do have updates. We have had some changes in respiratory surveillance. So I do have a new update, which I think we have pulled up there. Perfect. Community level for COVID-19 continues to be low. One of the changes that is occurring, we just received notice from the state that the contract will be ending for AMI, who will vaccinate for us. It started in January 22 and come in and do the vaccinations here. So that contract will be ending. Most likely we go through December. Maybe we can go 2 weeks into January. So one of the things we're assessing is it appears that we have an adequate amount of vaccinators in the area. The questions that were asked at our healthcare call is really the ages 5 and younger. Not great access for that. So we'll be looking to see what we can do to ensure that there is access for those parents who want to get their children vaccinated. And COVID testing is real low, most likely due to everybody being able to do home testing. So we're going to be talking about that. Most likely we will probably start to think about discontinuing testing. But we do have home tests available that we can give out to people. Respiratory illness is definitely picking up from the previous slide. Okay, so that was the old slide, and what's in front of you is the new slide. So we're pretty much all red now. Moving on to the next one, which is the surveillance where it has influenza on page 2, RSV, rhinovirus.
So at the time that my report was initially put out, RSV was the predominant illness that we were seeing. That is now starting to trend down, and influenza is definitely becoming prominent. Probably in the last 2 weeks, we're really starting to see that testing. Shake her head. Was on calls with LCO Health Center. We're monitoring there as well, because we're able to get some lab reports that are very current, and that's what they're seeing as well. Also seeing that influenza A is what we're starting to see by typing out. It is at this point looking like the vaccine a match for what we're seeing. And then on the last page, this is a slide that really shows the influenza activity that we've seen over the last 5 years. And so it's really interesting to follow these trend lines as we go through. Those of us who worked in the hospital in 2019 and 2020 remember that was pretty significant time in January, February. But we now are seeing a much quicker rise in influenza than we expect to be seeing. And that combined with RSV and a lot of the other illnesses that are happening right now are having us really watch our hospital systems to see where things are at. At this point, Hayward Hospital is doing okay, but what we're seeing is still taking quite a bit of time if you need to transfer to a higher level of care. Some boarding going on in the ED before they can get transferred out. The other thing that they aren't able to get patients out of the beds, inpatient beds or swing beds in the hospital, because they're not able to find a long-term care placement, either getting home health in their home and or a long-term care nursing home.
What's the vaccination rate going for influenza?
Influenza vaccine, we
On
are,
target?
we're behind. Everybody, I think, is kind of sick of getting vaccinated.
Yeah.
So we're kind of running into that. It's still not too late because we're just starting to hit the season. So there is a potential of getting vaccinated and having that 2 weeks and having immunity. So we are messaging that out on our healthcare calls. We're talking to all of the clinics about making sure they're messaging that to their patients. LCO is working through definitely having vaccine. They're offering that all the way through the LCO Health Center. And we'll just kind of keep pushing on it. We are seeing about a 3% rise each week, though.
You mentioned earlier that the vaccine was a good match for this
So far.
influenza A.
Well,
Are you promoting that?
Yeah. And that kind of covers that respiratory report. Any questions?
Are there any age groups that are affected more or less with this influenza A?
I don't get ages in this. What are you seeing, Dr. Dunlap?
I think predominantly right now, people with concomitant disease, like people with COPD, usually the elderly, but we have like the RSV in both elderly and children hospital.
For hospitalizations, yeah. But overall, I don't know. I mean, I think it's across the board. We were seeing that. Yes.
Contagious.
Right. Okay, so and then the other report, if there are no further questions on that, we did do water sampling in Brown Lake. That is on a PowerPoint. I think it's fairly self-explanatory, available for questions. I could pull out some of the key things with that we were kind of surprised with, but we probably shouldn't have been, is manganese. It's not something that we hear much about. It's something that naturally occurs in our water here. But if you get too high levels of manganese, it can impact the nervous system. So people can sometimes have Parkinson type responses to that. It's typically seen in water that's high in iron. And so really, if you're filtering for iron, manganese is getting filtered out. So that was one of the things. The other thing that we thought was interesting is the number of high lead that we would see on the initial draws off the water until before they let the water flush. And even though we have most of our pipes are changed out, there was people with brand new homes that were finding this as well. that they were having high lead right away, and then find after flushing, those brass fittings can leach out lead. So we'll really be doing some educational pamphlets on manganese and flushing your water if it's been sitting for a while before using it for drinking water. And so we'll continue this for the next 2 years with Brown Lake. The other nice thing that happened was Stevens Point came and did a presentation. It was hybrid, so people could come in person or via Zoom, ask questions about the test results, and then learn about water management.
Do you know if they're just taking water from people's wells? Is that where they're getting it, or is there?
They're taking it, they're doing the draw directly from their house. So,
Oh, turn on the tap.
yeah.
Okay.
So they actually had how to draw your water. So one of the draws was right away while after the water's been sitting overnight, and then letting the system flush and do another draw. I think there was probably about 3. No, I think this one was 4 or 5 bottles that they were testing different tests with.
So
And I
it's,
did have a typo, by the way, on the thing. I didn't catch it. Not reasonable. You don't have to work your day. Oh, I didn't want to say anything.
All the color you're distracted from.
Any other questions?
I mean, so you said they're gonna do this for a couple of years, so they're not done. So this map of Round Lake with all the 1s and 2s on it, that's
where they did do the testing from, and they're going to try to expand that so they get more coverage across the township.
What triggered that, this little manganese thing, is it tested every year? They just happen to find some somewhere? So
No,
they-
we haven't, actually, we've never really done a full sampling like this in the township. The town of Round Lake wanted to get groundwater sampling done now, or so that we could start to see if there's nitrates or anything in the water. And just in case any other businesses want to come in or farm, different types of things that could contaminate the water supply. So they wanted to have a baseline.
So is the township that approached you guys for this?
Yeah.
Oh,
So the township paid for they paid for part of the cost of it, and homeowner paid for the cost. So we're kind of trying to get that out there. And they plan to do that for the next 3 years.
wonder what
Or
that
2 years,
costs.
excuse me.
Wonder what that costs.
I think that they're probably putting 1,000 away in a budget just towards water. And I could be wrong on that.
Chairman,
yes, Mr. Chairman.
the coliform bacteria, 4 samples positive. What do they do then?
Then we'll, what you do is you treat your water with bleach or chloride. So in the well, so what we'll do is we'll test, and then sometimes that test can be contaminated just because of the way that they pulled the test. So then we'll do another test to recheck. And then from there, then we need to start talking about how they would get their well cleaned. Can happen from a number of different things. Most of the time it's gaps and leakage around the well. That was a nice thing about Stevens Point being there, is he really talked about how you take care of your well, make sure your well system is clear. So he did a lot of teaching with the town.
Is all that leaching, would that probably expand more outside of Round Lake into the flowage and grindstone?
Are you talking
and
about
river?
manganese?
Yeah,
Manganese is just gonna be anywhere where there's high iron, so it's just gonna occur. So it can be really throughout our county, so that's why we really need to start talking about, okay, if you're cleaning out, if you're filtering for iron, you're probably getting the manganese out of there, but if you're not filtering and you have a high level, you want to do that. So we're gonna make some different recommendations. Manganese was not in our typical homeowners package before. But we approved that new metals package last. Remember? And that includes that now, so we'll start to be able to see that more.
What about the depth of the well or a sand point? Is that gonna be more susceptible to some of these?
You're getting a little. Too
Okay, sorry. Just thinking as much as I'm asking.
I can answer.
Your shallower the well, that
right.
It depends, yeah, it depends, but you would have leach, so nitrate would probably leach in easier, so if you're having, if you think if you're fertilizing a lot and your well is shallow, it's more likely to get. Nitrate's not a typical thing that we have problems with in this county, which is great, because a lot of counties have very high nitrate levels to deal with. And kind of a preliminary, they are starting to do PFAS testing, I'll bring that to another meeting. We'll try to keep getting results in, but I haven't had any high results yet. So we're gonna get that mapped out so we can see how that looks for the coming to.
So if they didn't test this out, they didn't do a test for like 20 years, what would happen, I guess? If they never tested the waters and found this manganese, would it affect, I don't know, nothing?
Manganese is naturally occurring, so it's really taking it in too much. So if you're drinking a lot of your water, depending on how you're cooking, the age that you are and how you, you know, if you're older and unable to process things through your body as well, you're more likely to have some issues with things. Yeah, and it's fairly new that they're identifying that that is what's causing some of the kind of that. Just want to be aware of it. And I'm not thinking like it's
Right.
crazy,
Right.
like we've got this major problem.
I've never had anyone come back from neurology saying
I'm more
toxicity is like it's
I'm more
Right.
concerned about bacteria, finding that right away and taking care of that, and really making sure less of young kids in the household that they're not having a lot of lead in their water.
But you're still promoting water is better than soda.
Yeah, I will say that.
Ms. Pettit, Mr. Rusk, Mr. Maestri, do you have any questions or comments for Ms. Lyons before we move on?
Nope, I would just like to move on.
Okay, great. Great report, Ms. Lyons. And personally, I think zinc should be spelled with a K. It looks better. So we can move on to number 16 then, fiscal. Budget performance report. Is that
Patty's online.
oh, Patty, what do you got for the budget performance report?
It's just your standard budget performance report, showing where we are today. Is this last month's, or I can't see, this is through October. So this is the current one. Last month I did bring through September. At this point in time, we're looking to be, it's looking at this point in time to be on pretty much on budget. We have only 4 months worth of Winnebago Mendota bills in so far this year. So through the purchase service recap through October, it does show only 4 months. And with, as Joe stated, with some additional stays, that is towards the end of the year. So I still overall, it is looking like we will be within budget.
Okay. Any questions on that? So then we can move to 16B, the purchase services recap.
Right, that just details out your high cost within the budget, which is purchase services by line item of what was budgeted, the total spent to, you know, for the period of time. But again, the Mendota Winnebago is delayed. They're that far delayed with the state billing us, so. The rest of them you can look at pretty much it being 4-10 months.
Any questions for Patty?
I'm good, thank you.
Okay, appreciate it. Thanks, Patty.
You're welcome.
So we'll move on to number 17, future agenda items. Does anybody? Yes, Paul.
I have next month's agenda item already solved. About economic support. I text Shauna.
Mhm.
Simple math would have solved the issue, and I think you were already doing it in your head. It is a monthly statistic. And if you look at the number of cases and divide that by the over 555 million, anyway, that 555,000, you come out with $471 per month per family. And then if you project it, I think that's where you're getting close to the 7 million. It was like 6.6. So that is a month. What I don't know, and I get the clarification is a month meaning the October report is a 10/1 to 10/31. I'm assuming it is.
Okay.
So just to find the calculator.
Yeah.
Figure that out. There you go.
Anybody else? Future agenda items?
No. We got some people retiring soon, don't we? Health Human Services might be in this room right now. In the near future, do you guys have like a right-hand man or someone who can walk and take your place when and if you do retire tomorrow? I mean, when it comes down to it, we're talking about case or improper management or whatever at the state level earlier. Just in case, you know, Paul, you do a lot, and Joe, you do too. I mean, do we have somebody? Do you guys have people ready in line that you're molding into taking your role when you do retire?
I guess that would be an answer for the administrator.
You know, I don't know.
I'm not.
We are having, I mean, the big issue is the behavioral health crisis response, and we are having meetings on that. And hope to have a plan place sooner rather than.
The short answer to your question is no. We've been talking about it for a few months and have talked about alternatives for the on-call and the local crisis.
Our clerk just retired over in our township and she left and she did a lot more than we thought she did. And so we kind of ran into a position like, what do we do now? Our hands are up in there. She just gave us her 2 weeks of totally appropriate, but I just want to make sure it didn't happen here with this group, I guess. So
Yeah.
that's why I asked that
Joe gave
question.
us a year, not, well, I don't know when, nobody's given us a
Right.
retirement.
We don't.
It might take a year to learn these jobs, you know, so that's why I brought it up.
We're talking that they are going to retire next year. And what are we going to do that happens? So there's a happens in place that they're looking at alternatives. We've talked about alternatives. I have some ideas. They have some ideas. So.
Cool. And we are meeting on those ideas.
I'm satisfied that as long as you brought it up.
I don't think that needs to be on the agenda.
No, I was just bringing it up, I guess.
Okay. Andy, did you have it? No. All right, let's move to number 18 then. Which,
I had my hand raised.
I'm sorry, Dawn, I didn't see that.
It's okay. It's okay, Jess. This is an issue that has been, since I've been on, I was a supervisor at least 4 years now, about having individuals shadowing Paul and Joe and the other behavior specialists, because within Joe's division, there's probably, I want to say 60 plus years of experience that we haven't hired anybody to, even if it was somebody younger, to bring them up to speed and give them the knowledge that Joe and the Paul have. And this is the issue within the county. We're always behind. We will lose Joe, we will lose Paul, and we will have no one to fill their spots. There is no one coming into this area with their knowledge, their education, and their experience. We cannot get anybody into this area for coming out of college or to have the experience. It's not going to happen. They have to be in and working. It's just not going to happen. We're going to lose 3 people probably in 5 or less years that have so much experience, and the county is going to be at a loss. It's just that simple.
Yeah, okay. Thanks, Dawn. All right, any more hands up? No.
No.
Number 18, correspondence reports from conferences and meetings. I don't know if anybody has attended any meetings that we haven't already heard about. And then there should be something here that says adjourn, but there's not. So if there's nothing else, then I have nothing else on the agenda. So we are adjourned. Thank you.
Thank you.
Right out the hill.